Atrial fibrillation is an abnormal rhythm abnormality, one that we consider in general to be a non-life-threatening rhythm disturbance. It varies from a symptom standpoint to no symptoms at all in perhaps a third of the patients to severe symptoms in patients that are terribly debilitated by the problem. I wish I could have some brilliant way to tell you that we could protect people from having atrial fib, but unfortunately even very healthy, very athletic 30-year-old men will occasionally have atrial fibrillation. The most common patients that have Afib are people that have other heart disease. Patients that have atrial fibrillation in general are at increased risk of stroke, and so strokes can obviously be a terrible consequence of the rhythm abnormalities. The treatment involves three components. We treat to control the heart rate so patients don't go too fast. We treat to help protect from stroke risk. And then we treat to help keep people in normal rhythm. Patients that have a stroke risk that borders on 3 to 5% rate of stroke per year, we consider they need to be on blood thinners. And for some patients, the blood thinner therapy is almost as debilitating as the rhythm abnormality itself. The most common drug, and a drug that we've used for probably 50 years, is a drug called warfarin. There are 4 new medicines that have been released on the market that do not require monitoring. So they've provided some incredible freedom to patients. We have been performing catheter ablations for over 30 years now. Success rates for most everything we do is very, very good, in the 95+% range. So we're very good at fixing most rhythms. The latest thing that has occurred is that we're now looking at mechanical options to protect patients from stroke. So we're using a new device called the Watchman that we've used here from an investigational standpoint, and it's now been released by the FDA. And the interesting thing about cardiology and cardiovascular procedures is that the more we do mechanical approaches to treating heart disease, the better we get. So mechanical means of protecting patients from stroke risk may hold the best hope for the future to protect patients from stroke.